Hi, my name is Ching. I am a registered nurse and I've been nursing now for 6 years. I did the emergency nursing program last year through UPEI with Tanya Matthews. It was a wonderful program, taught me a lot about different health problems that we often see in the emerge, how to assess these situations and cope with them, and the proper treatments that we would expect to see happen. It helps me whenever I'm triaging so that I can determine the acuity better, helps with my critical thinking skills because I can apply the knowledge I have learned from the course to the actual patients whenever I'm working with them, which usually allows them to be triaged a little bit more appropriately as well. I had signed up for the program. Initially I heard about it whenever I was still in university. Tanya came and talked to the class and told us lots about the program, and it sounded quite interesting at that time. Whenever I started working in emergency nursing, I really wanted to have that extra knowledge. I felt like I needed to challenge myself a little bit more, so going through this program, it was a full-year program, so I felt it was full of a lot of information that I could apply to my practice. So some of the different things I learned had a lot to do with electrolyte imbalances, which we don't focus a whole lot on in nursing school. So just kind of seeing how those different electrolyte imbalances affect our body and what different assessments we'll see, whether it's through an actual physical assessment of the patient or seeing their results in their EKGs or their blood work results, of course, too. And just knowing the different ways to treat them and the different medications you would use and why, that stuff was very interesting to learn. I find the difference that it has made for me in patient outcomes is my ability to assess patients more appropriately. I'm looking for specific things whenever they're coming in with certain complaints. I find that a lot of the times now, instead of waiting to hear what we're working on for a diagnosis, you're kind of already thinking of what it is and already stepping ahead to know what your treatment plan is before you actually are given the orders to do this or do that. So I find it helps me to work much better as part of the team as opposed to being just the nurse kind of following the orders. Through taking this program, I find it has changed my practice because it has made me much more aware of the different assessment skills I should be doing with my patients. Find that this course kind of puts more emphasis on the assessments that are necessary depending on what their certain complaints are. I find it affects the wait times because you are able to triage more appropriately, get patients seen whenever they need to be seen depending on what their health history is, and including the reason that they're there for that visit that time. I also find too that it just kind of helps you work as a team a lot better. Not to be intimidated by it. It is a year-long course, so it is a lot of work and a lot of time, but there's so much support there and it's such wonderful information. If you're working in the field, you already know most of it and you're building on your information that you already have as opposed to learning from scratch. So it just kind of helps to expand your knowledge base and allow you to apply it better and understand more. In closing, I'd like to say that as a registered nurse, whenever I am working with my patients, regardless of the location, I come to them with a body of knowledge using my code of ethics that is provided to me by the Association of Nurses of Prince Edward Island, being responsible and accountable for every decision and all the information that I do give my patients so that they can continue to learn and take care of themselves too.